We're down in Belize, Orange Walk. We just accomplished a week of preventive air abrasion dentistry on patients. I'm here with Tim Rainey, one of the founders in preventive dentistry with air abrasion. And we'd like to ask Tim, what were your goals coming down here using air abrasion in preventive dentistry? What is that?
Okay, first of all, what is air abrasion? What we're using is a miniature sandblaster that was developed over a period of a couple of decades. It's extremely selective in what it removes. It goes after unsound tooth structure, and it takes only the unsound tooth structure away, leaving the tooth sound and solid. The tooth is even stronger than it was before we started. Plus the procedures we've been doing, we've developed that over a period of around 27 years. The original restorations we did 27 years ago are there. They're so reliable that I warranty those restorations for my professional lifetime. That's over a quarter of a century. Most dentistry is repair of old dentistry. That's what dentists do 80% of their time. They're repairing something that was supposedly fixed years ago. We've wiped out decay for a full generation of kids in our community. We're now into the second generation.
Very impressive. Like we said, warranty. I mean, that's something I've heard of in dentistry. It's very powerful. Tim, when we came down to Orange Walk, you had certain goals in mind. Did we accomplish that, your goals, and how this week turned out for us?
This week turned out exactly the way that I expected it. Tom and I had come down here before. Tom White, he and his wife are the owner of International Health Outreach. Kathy White, it was her idea. We had done a previous mission under auspices of another group going into the Dominican Republic, and so we had a real good idea of what needed to be done here. We came into Belize with the expectation that we would see a bunch of kids be able to, we call it bulletproofing their teeth, and then take at least one or two dentists who were novices at this and turn them into accomplished practitioners. We had 5 dentists along with us on the trip. Enrique Trevino from Mexico, his associate Elena, and I'm not going to try her last name at all, Dr. Jim here, myself, and Elena was a complete novice at it. She's actually trained in prosthodontics and very accomplished at what she did. And I sat chairside for about 15 minutes, about one quadrant. She was up and running. It's fast, easy, simple. You don't need anesthesia. We're treating full mouths on these kids. Every tooth that we can find, any little nick, niche, cranny, any place it could possibly become decayed, we clean these out, and then we go back in and seal them, fill them, whatever you want to call it, permanently with glass iron or cement. And once again, it's extremely reliable work. What happens is on most of these trips, dentists are coming in doing triage, and that means that they're trying to fix stuff. They're trying to extract teeth, fix big cavities, and everything. It takes us over 5 times as long to treat one kid with the usual decay you start seeing around 16 to 20 years of age, as it does to bulletproof 5 kids who are up to about the age of 12. When it starts getting over 12, then we start getting into larger cavities and so forth. So it makes a whole lot more sense to come in and do the prevention rather than trying to come in and fix stuff temporarily, since that's what dentists do anyway. And the other question that I keep asking dentists, okay, so you're going to come down here, you're going to do a filling. It's going to last 20 years. Where are you going to be in 20 years? Who's going to be there to take that tooth out or redo it or put a crown on it or whatever? Why do you want to do temporary work?
Very impressive. One of the other key that Tim said was without anesthesia. Tim, tell them the number of patients we saw this week and how many restorations you did, and this is done primarily without anesthetics, the technique that Tim has developed in here.
We saw over 200 patients between the 5 stations. I mentioned 5 dentists. My Kathy White is actually a dental hygienist. She's an accomplished minimally invasive dentistry advocate. She can do everything that Dr. Jim and I can do, and so between the 5 of us, we were able to crank out over 2,500 restorations. If you look at that, look at those numbers and divide it by 5, the average dentist could easily do 50 in a week and easily do over 500 restorations. And this is far beyond what the average dentist accomplished in a week.
One of the amazing things was the equipment where we did this at, we actually used church benches raised up on cinder blocks, and those were our chairs to work in. So it can be done any place. This is our church we worked in, so it can be done any place. Very minimal amount of equipment involved with this, and it was just quite amazing that we turned this church into a dental operatory. People were coming out of the woodwork, and just tons of people showed up, and great service was provided. Tim, my last question is, we have learned a lot here this week in Belize. How can this information be taken back home to our offices? What do you hope to accomplish with this back home?
Dentists are like anybody else. We're always reluctant to get out there in something beyond our comfort zone. When we bring people in here, we immerse them, and then what would take them months to accomplish, by the end of one day, they've done so many restorations. They've been overseen by accomplished mentors. I did a lot of mentoring on this trip. Kathy did a lot of mentoring, and by the end of the day, everybody's pretty much up and running. And we really don't understand why there's been such a reluctance on dentists to get rid of what does the most damage in dentistry, and that's the high-speed drill. A high-speed drill is a death sentence for teeth. Amalgam is a death sentence for teeth, and fortunately the FDA has come in and said, get this stuff out of dentistry, get the amalgam out of dentistry. But we eliminated the need for the drill over a quarter of a century ago in our practice, and we don't know how many thousands of patients we treated, and tens of thousands, but on a daily basis we get to see restorations that have been in at least 10 to 15 years. And once again, if that warranty didn't work, I would be out of business. It just simply works, and there's other serendipity side effects. Since we're not microfracturing the teeth with the high-speed drill, the teeth are sound, solid. We aren't leaving other avenues for decay to begin in the teeth, and then that's why these teeth last. We also are eliminating where the areas of decay can begin. Decay is just like, in one tooth, it's like having a rotten apple in a barrel. It affects the other teeth. And now then what we're seeing is a decreased incidence of overall decay. So when we start talking about eliminating 80% of future dentistry, I think if the studies were done on our practice and our patients that we've seen over the decades, I would believe that it's going to be somewhere in the 90th percentile, because the restorations eliminate the areas and the materials, eliminate the bacteria that can cause decay in other teeth if there's any type of defect. The other thing is, a high-speed drill is called a turbine. How do you generate electricity? You use a turbine. There is a tremendous amount of electricity that's generated with a high-speed drill. That's why we need local anesthetic with a high-speed drill. It's not necessarily that the tooth is sensitive. It's because when you put a lightning bolt through the tooth, and I can see a lot of people out there cringing because they know exactly what that felt like. When you put a lightning bolt through the tooth, it hurts. So we deaden the tooth so we can destroy healthy, sound tooth structure. It's just a matter of understanding what we're trying to do. Take the decay out. Decay is the dead area of the tooth. It's like cutting your fingernails. And then once you remove the decay, then stop while you before you get into sound two structure. That was one of the hardest things to learn. And
out of character.
Just quit. You've got the decay out. Stop. Okay. And now then, go ahead and restore the tooth and walk off from it. And once again, it's fast, simple. I would say it's relatively easy.
Amazing. It's hard to believe how easy it is once you learn the technique and the knowledge behind it. Incredibly easy.
One of the liaisons with the Belize government was a retired nurse, and part of what she's done in the past is act as a liaison between dental groups that are coming in to try to alleviate the pain and suffering. And she was so blown away by what we're doing. She was sitting chairside right up against us, talking and keeping the kids calm. There's some little techniques we use in there. She was very good at it, and she went and got her 3 granddaughters and brought them in for us to treat and asked us, when are we coming back, because she doesn't want anybody else touching these kids. And once you as a parent, or once you as a caregiver can see what happens with these kids and how easy it is and how painless it is and how fast it is, then there isn't any other way or anything else that you ever want done to your children's teeth. This stuff of bringing kids in, we saw kids as young as 2 on this trip. We worked on kids as young as 18 months in my practice. And then once again, we don't need general anesthesia. We don't need local anesthesia. We aren't putting the kids at the risk of the brain dysfunction that is now being associated with general anesthesia in kids. We're eliminating a fantastic amount of risk, and we build trust in these kids. The kids look forward to coming back. They're not scared of the dentist. The kids that we had the most problems with, take this to heart, take it to mind. The kids we had the most problems with were kids who had been seen by traditional dentists, which is exactly what happens in my practice.
Very incredible. Magical stuff, incredible technique, quite revolutionary. I appreciate your time. Thank you very much.
Thank you.
My pleasure. Thank you.
It's been a pleasure having you around again. Thank
Very
you.
good.
Looking forward to many more.
We'll do it.
All right.
Thank you.